Let's queer up health. Watch Queer News Tonight anchors get the new COVID booster live as DeSantis says no. The new COVID-19 booster rolled out this week. The CDC cites rising COVID rates and serious hospitalizations and even deaths at a time when the LGBTQ plus community thought COVID-19 was over. The FDA says that this is the major reason the entire queer community should get the new booster. Florida Governor Ron DeSantis says no one under the age of 65 should get the new booster, creating mass confusion for the LGBTQ plus community as politics of a presidential election are at odds with sound medical science. Queer News Tonight has invited experts from Holy Cross Health, one of Florida's most respected medical hospital groups, to talk to us about the new booster. As we discuss the vital issues, you will watch anchors at Hotspots magazine, Happening On Television Network, get the new booster live. The new shot is formulated specifically to target the XBB 1.5 subvariant, which made up a considerable percentage of COVID cases through September. According to the American medical community, those who were vaccinated or got the booster in the past, their COVID immunity has likely waned. The new shot is a chance to strengthen it. Dr. Mark Mulligan, director of Vaccine Center at NYU Langone, said it's not a booster, it's actually a new shot. He said, quote, "Unlike the shots from last year, this new vaccine doesn't protect against the original strain of COVID or early Omicron strains, such as BA.5. Instead, the new shot is formulated specifically to target XBB 1.5 subvariant, which accounts for most COVID cases now." End quote. Both Pfizer and Moderna say the new vaccine should also protect against BG5, which is expected to be the next dominant subvariant. A final question is, why would DeSantis and Florida Surgeon General reject FDA guidance on the COVID-19 shot? DeSantis said last week, quote, "I will not stand by and let the FDA and CDC use healthy Floridians as guinea pigs for new booster shots that have not been proven to be safe or effective." End quote. Then Florida Surgeon General Joe Ladapo recommended support for the governor on his position. Both of their opinions were soundly rejected. Surveys show more than 90% of the American medical community widely rejected the governor's statements. A leading criticism is that the anti-vax position landed well with the most entrenched of the GOP base, who denied masks, vaccines, how COVID happened, or even if COVID existed. Anti-vax organizations and conspiracy theorists have become a cottage industry since the pandemic. A leading criticism is because of money. Anti-vaxxers are now a modern political force. The once fringe movement is now seeing an influx in cash after the COVID pandemic. According to Politico, analysis of tax filings, revenue more than doubled for the Informed Consent Action Network and Robert F. Kennedy Jr.'s Children's Health Defense in 2021 compared to the year before. There are some of America's leading voices in vaccine conspiracy prompters. Some anti-vax nonprofits raise as much as 15 times more money today than they did in just 2017. In other words, being anti-vax seems to be good for elections and getting money. So it's incumbent for the LGBTQ plus community to have a conversation on the new COVID-19 shot. To help us, we've invited Von Biggs, Community Outreach Coordinator, and Kim Sayswick, the Vice President of Community Health and Wellbeing for Fort Lauderdale's Holy Cross Health. We are going to discuss COVID-19, the vaccine, while I and Elimination and John Hayden are getting ready to have the shot live. your immunity in conversations for the COVID-19. Vaughn, Kim, welcome to Queer News Tonight. We thank you so much for being with us. Before we get the booster shots, tell us about where you think we are in COVID, especially for the LGBTQ community. Where do you think we sit?
Well, Al, and thank you for inviting us, first of all. We're very pleased to be here. Probably our LGBTQ community is more informed than some. However, what we see is many still have not received their vaccines, whether that be their original or the booster that came out. I worry a lot about community because we know that folks who do have HIV/AIDS, who are immunocompromised, are at much higher risk of hospitalization. And that this shot, although it may not prevent you from getting COVID, it may prevent you from getting so sick that you need to be hospitalized. And I think that's the most important takeaway here. It's not meant to prevent the disease from occurring. It's meant to protect the person getting the vaccine from being hospitalized and possibly dying. So I think it's really important, especially for LGBTQ community, to be informed, to be educated, and to make good choices. Their health depends on it.
And Vaughn, you're the community outreach coordinator for the Holy Cross system. You're a member of the LGBTQ community. Here in South Florida for Holy Cross, we've kind of fallen out of touch about what's going on in COVID. We say in our story that we kind of got to the point of going, well, it's over, we're done. And we're finding and reporting that the numbers are rising again. How do you think the LGBTQ community is doing in terms of paying attention to COVID?
Well, Al, I think part of the discussion is that we lost the discussion about COVID in general. It's not newsworthy. It went away. And people even would come in for vaccines and we would talk to them and they'd be like, oh, we got our first 2 vaccines and we got the initial booster. But in reality, with the last bivalent vaccine, only 20% of Broward County received the new vaccine. So they were still they're not getting the vaccines as they roll out, and their mindset is they were vaccinated. And I think that's part of the issue is still the education. Hospitals are still filled with beds with people on respirators, still sick with COVID, but you don't see it in the news.
Vaughn, let's wave the magic wand and say that you speak for every LGBT person in the world and listening to our broadcast. How is the LGBT? We hear you loud and clear in terms of it's not fashionable, it's not in the news, we're not paying attention to it. Any differences that you see from the LGBTQ community? Are these same kind of issues that you're talking about, what we're experiencing in the LGBTQ community?
I think in some respects, yes. I think we're so blindsided by some of us really pay attention to the news media, especially I feel in South Florida. A lot of people are very educated. They know what they're in for. They call, they want their vaccines, but there are a lot that are still misguided with the information. So I do think we're not as good as we think we could be.
Yeah, well, we're very lucky today. We wanted to indicate and show, the science is overwhelming. That's what our story says. So we're not going to argue the validity of the science. That's already completely established. So that's why we
believe the experts on that one, right? We believe in science there.
Right, we believe in science. So Kim, if you would like to join us. Now, what we're getting ready to do is we're going to have this COVID shot administered. It's coming to Elimination first. One of the things as we do this, Kim, and you start with Elimination, I want to ask about the situation with you, Faye. You've recently recovered from COVID-19. First, let me walk us through your story. Did it catch you by surprise that you got COVID?
It totally caught me by surprise, Al. And, you and I have traveled so much in the last couple of years that we've got it booted and booted and booted.
Yeah.
We were up to like 6 shots or something like that.
I do it as a cocktail.
Right? Like in the morning with my vitamins, and so it did catch me by surprise. And, and I'm shameful. I feel shame about it because I had a little cough and I thought that, it was just a bug that everybody was that something was going around, right? And I thought it was just a bug. And no, it was this new variant. And my wife is a nurse practitioner, and she always called me the COVID cockroach, because in 3.5 years, I had never gotten COVID.
Yeah.
Now bring in this new variant, and it didn't give a crap about me being a beautiful Amazon Puerto Rican. It got me good, good.
And that's another thing that I wanted to ask you about. I was communicating with you. I could tell how sick you were.
I was so foggy, Al. I have never been that sick, and I am not a person that usually gets sick. I had 101 fever for a day and a half. I was on Paxlovid. I'm blessed that I don't take any other medicine that would go against the Paxlovid, right? So it was, and I do believe that because I had gotten vaccines and I was boosted, that also did help. So it was 4 horrible days. But I know people that weren't boosted, and they've been sick for 2 weeks with this new variant. It's not playing around.
Yeah, Kim, and we're undressing here. Let's ask Elimination. You've had the shot. I didn't hear you whimper. And you whimper over everything. So.
Well, every time they put me beside you, I clearly get that whimper. You see what happens. But Kim was awesome. She did an amazing job. The stick was awesome. I'm so glad and thankful to have this shot. Al, you joked. We joked, but in seriousness, talk about how we believe the sciences. We have to believe what history tells us. We lost so many people through COVID. I personally lost a brother and an uncle. Mm-hmm. So I was, thanks to the staff who said, we're going to get this done, I was first in line. Yes, allow me to be here, because as to Faye's point, we want to make sure that if we get it, that we're here to talk about it, that we're safe, that we're going to be able to be sustaining without having to go to the hospital. We know that rates within minorities are skyrocketed. We have to, we're often those that are in the hospital and for long periods of time. And with this shot, we'll avoid that opportunity, at least for me, and hopefully people like me.
And unfortunately, that's because of what Kim said, that people believe that just once they got that first vax or second vax, that's it, they were done. This is not like the measles, folks. You know what I mean? This is something that you have to continuously, the new variants come out, people do their jobs, and we get new vaccines, and that's what we do.
We got so fatigued. Folks are so fearful that they're avoiding it because nobody wants to go back into that COVID mindset of I'm gonna be stuck in the house. I can't go back out. And so we're us as LGBTQ folks, we want to go party. We want to have our social time. But the only way we can really do that safely is we all get vaccinated, so we can all come together and stay safe together.
Can I ask Nurse Kim a question real quick?
Vice President.
Hello.
That's why I waited to ask her questions till after I was done. I don't want to get anything wrong. A couple questions. Well, I didn't realize that this is essentially a new vaccine. So anybody who might think, well, even if I got COVID but I never knew it, clearly my body is okay. But we're saying now that's not the case. This is essentially a new disease, albeit it grew out of COVID. But the point is, even if you think your body beat it, and maybe it did, and you never even knew it, we need to get this shot now instead, right? Or in addition to. In addition.
Yeah, absolutely correct. It is a different formulation. And it is specifically, as I was explaining, it's for XXBB 1.2. And that is a different variant of COVID. And it's really important because even if you had COVID before, even if you had it twice before, this is a different strain. It's just like if you had the flu and you got the flu shot last year and the year before and the year before that. It changes every year. So like the flu shot, you get that every year. You need a new COVID booster. And if you did get a COVID booster, let's say more than 2 months ago, it's time to get this one because this one's different. It's new. It came out this week.
And wait, I'm sorry. I want to jump on that point because for clarity. Even if you had a previous booster to this new announcement, it's brand new, that's been rolled out, FDA, CDC recommended, you recommend, if you had that booster in July, still get this booster. Is that what I heard you say?
Absolutely. That's what I said.
And how about if you had COVID like myself a couple of weeks ago? Like people are saying that I can't get the booster. Can I get the booster? And should I get the booster? How does that work?
You absolutely can get the booster. It's recommended that you wait just a bit of time to allow your body to heal.
How long is that recommendation?
3 months until you get the booster. If you feel you're ready before that, it's not contraindicated, but you would not get it while you have COVID. Of
course. She's Al is as well, getting ready to go overseas in November. So would you, if that's in the 3 months since you had it, would you recommend she get it before she travels overseas?
Yes.
Okay.
You know,
I have one. I'm sorry, Dino.
the timing of this also is coming, is the beginning of also flu season.
Flu season,
So now they're
yes.
giving the flu shot along with this booster for COVID,
Absolutely.
which people, I just got it on Monday, both at the same time. No problem at all. I mean, just if you go to the pharmacy or to your doctor to get it, at the same time, and just get yourself covered if you haven't got
Let's
it.
check that box off too. Kim, your recommendation is that would you recommend both this new COVID shot and the flu shot? And if you do, can you do it in the same sitting like Dino did?
Absolutely. It has been proven to be safe. There's no reason not to get them both at the same time.
Yeah.
There's no contraindication.
One last question, and I know that there's no appetite nationally or probably even on this campus here to bring mask mandates back. But I'm starting to see people, not necessarily when I'm out in Wilton at the clubs or anything, but when I'm at Publix, when I'm at the Walgreens, a lot of people are voluntarily starting to put masks back on because of a lot of the coverage that we've had the last couple of weeks. Where are we on, should we use masks? Are they effective for this round? What should we think?
I don't think we can look at it for this round. I think we have to ask today and now. Al showed the picture of the United States, the CDC map. You saw some were red, some were bright orange, some were more yellow. That's where we get our information. And as CDC tracks and sees that disease is rising, the numbers of people are rising, they will change those colors from yellow or green to bright orange and then to red. And at that point, you absolutely should try and protect yourself. And one of the ways is by wearing a mask, especially if it's indoors, especially if it's large crowds, especially if you're close to people.
I want to ask about why we're really what our motivation to do it this way. We could just report that we all got vaccinated, but we wanted to show the vaccination and talk about the issues going on. I just ask from the standpoint, when you saw the political response of, and Vaughn, let me ask you this as the community representative. When you saw representation of the Florida government say, don't get the shot, and then the Surgeon General of Florida comes back to say that, did that surprise you from your seat in terms of being in our community? We're so science affirming. Was it surprising to you that you saw that recommendation?
It was not surprising that I heard that. I feel a lot of us, through our own education, and we've learned that the truth is. We know, you think about the gay community and the LGBT community when MPOX came out, and how much we all came together and really fought to get vaccinated for MPOX. We still have a ways to go with that, but I feel like through our initial COVID trials that we went through when we were dealing with that for the first year, and then when MPOX came out, we jumped on the bandwagon, and I feel like the LGBTQ community was out talking to their doctors and out reaching out saying, hey, I want to get that vaccine. And I think we got ahead of it versus behind it.
Remember, we did a story about that, about how the LGBTQ plus community was coming out and getting vaccinated in that initial time.
In hours. We waited in line for hours and hours and hours because we knew how important it was. And so shout out and kudos again to Holy Cross, because our doctors who are reminding us how sensitive our needs are and how important we are, because we are so susceptible to certain things, and our funding is not always put in our community. And so if we don't have those doctors who are pushing us in those appropriate ways to say, hey, let's talk about this. You're same gender lover. Do you participate in this? Then here's where you need to go, and here's why. And so we need more doctors. And I to our viewers who are watching, if your doctor is not having those kind of conversations, check your doctor.
Get a new doctor.
Check your doctor. Check your space.
And speaking about doctors, I also had a friend that thought that she had to pay for this. Okay, you don't have to pay for this. They might ask you for your insurance to maybe go through them to get some money. I get it, but if you don't have insurance, they will still give you this booster shot. Am I correct?
And they're gonna start sending you also home the 3 kits.
Yes, that started yesterday.
The 3 testing kits. So this week, right?
COVID.gov.
is going again. So take advantage of that and have them at home.
Yeah.
One last point that I make before I want to make before I come back to Kim and we close our conversation here. This is near and dear to us in the LGBTQ community in South Florida. The winter party held by the task force was the outbreak of COVID-19.
You lost a coworker?
we lost an anchor at It's Happening Out. In early March, we were among the first tested in South Florida because of the outbreak. He went into the hospital 2 days after filming the show, and then went into ICU and never came out of the hospital. And Chef Josie, one of our anchors, tested continually for COVID for 44 days, and nobody could figure out what was going on there. And remember the days of you can't bring cardboard boxes into your house, and you've got to leave your shoes outside. I mean, we've been through a pandemic. We certainly have. And the amount of misinformation that took place all the way through the process, we don't want to repeat that again. So that's what we're trying to do in terms of putting correct information and showing you how easy it is to protect yourself from the variations that are still occurring and reemerging in COVID. Kim, last question that I want to ask for you. Is there anything in particular as, first off, we're all thrilled that I and all of us had our COVID shot from a vice president of a hospital.
Yeah, that's what's up right there.
Kim, I know you've got a lot to do, but I'm telling all our viewers, ask for Nurse Kim.
Yes. Yeah, Nurse Kim.
Ask for Nurse Kim.
A bazillion years that she went to school. She's loving that. But Kim, I'm curious, is there anything that you, from your seat at Holy Cross as Vice President, Community Health, your Community Health and Wellbeing title at Holy Cross, is there anything that you would recommend the LGBTQ community does to help overcome the misinformation that we're watching, from the governor's mansion to the Surgeon General to the anti-vaxxers? Is there anything that in particular that you would say to the LGBTQ community that would help your mission to keep us all healthy?
Ask questions. Don't just assume. And if you're not sure, call us. We're there for you. We're there 5 days a week. I pick up my cell phone 7 days a week, 365. We are happy to come out and do education. We'll answer questions, but please ask the questions. Don't say nothing, because silence can be death.
Yeah, silence can be deadly. Well, Von Biggs, Kim Sayswick from Holy Cross Health. They have great hospitals here in South Florida, and we thank you so much for joining us today.
Thank you, Von. Thank you, Kim.
Tonight.
We appreciate it.
Thank you.
We are Queer News Tonight, the world's first and only live daily LGBTQ plus evening news show, brought to you from Happening Out Television Network. We operate in the same model of PBS and NPR, but for the LGBTQ plus community. We educate, inform, and entertain by supporting the 10 pillars of our LGBTQ plus community, with more than 100,000 a week watching us on Roku, Apple Television, and other channels. To keep the story going, we accept donations with 100% transparency. Stay updated and live authentically with Queer News Tonight.